Hello there. In culmination of our long discussion of the differences between the state and the market and how we should walk that tightrope between state authority and market mechanisms, we're going to dig into the issue of healthcare. And we're going to do so for two primary reasons. First of all, this is just an enormously pertinent debate today. As we are taking this class, there is an active discussion going on in the Senate about what to do with a recent proposal that came through the House, how to reform American healthcare. This has been a huge, huge issue. And so one goal of thinking about this is for you each to develop your own voice and your own opinion on this really critical issue, and doing so by grounding it in really smart thinking and in political science. A second goal is just this will really help us understand all of these concepts that we've been talking about, from perverse incentives and incentive compatibility to the veil of ignorance, and so on and so forth. Healthcare is a really great area to look at the interactions between states and markets and how different policies are going to play out. So what we're going to talk about today is just a little bit of the basics of the U.S. healthcare system and some of the more recent attempts to reform U.S. healthcare. Now, the primary material for this part of the course is actually coming from that Frontline episode that is linked to here. It is critical that you actually spend the time watching that documentary. It's about an hour long, and it's a little dated. It came out in 2008, and that is, of course, before President Obama was elected and before he led the Democrats to the Affordable Care Act, or Obamacare. And so while this is a little dated, actually a lot of the issues on the table are still the same. And what it will do is go through other democracies, 5 capitalist democratic countries that have worked to change healthcare, and it'll compare those systems. It is really important that you watch that, as that will provide you a lot of the material for understanding this issue. So what I'm going to do here is just update us a little bit and set up the stage for your midterm essay, which will be asking you to come up with an argument for healthcare reform, grounding that argument in the course concepts. Okay. So to start off with, here is a simple statistic that I think should be the beginning point of the discussion. And this shows us data on per capita, that means how much per person, per capita spending. And we can see that the OECD average, this is an international organization of other advanced, industrialized, economically wealthy states. On average in this organization, $3,453 go to healthcare spending per person. Now, in the United States, you can see that we have more than twice that outcome, $8,713 per capita spending on healthcare. That is from 2013, so it's actually even higher now, and that's a lot, more than twice the OECD average, and of course, much higher than lots of other comparable states, all these other capitalist democracies that we can compare ourselves to. We are doing a lot of extra spending. Now, you might think we're spending a lot more, but we must be getting the best healthcare in the world. Well, while we do have some of the most cutting-edge medical researchers in the world, on average, our health statistics don't actually look any better. In fact, they're pretty much in line, whether you look at life expectancy or mortality rates, pretty much in line with the OECD average. And actually, in some ways, like with infant mortality, we're a little bit below average for other advanced industrialized states. So what gives? Why are we spending so much, and why aren't we getting our money's worth for this? Well, that is what we're going to be turning to, and that is what that Frontline documentary is all about. And so you can look at that, and they are going to give you some data on different costs of different systems and the various outcomes and how they work. So for now, it'll be important for us to think about the healthcare system that we are dealing with. So the U.S. healthcare system was pretty much unregulated. And we should note that that is, as you'll see in the documentary, very, very unusual. Usually there are a lot of regulations when it comes to healthcare in other systems. The U.S. healthcare system was moved a little bit more towards some government regulation with the Affordable Care Act, or what is commonly known as Obamacare. Now, interestingly, this was not a liberal idea starting out, and liberal meaning left, right in the United States. This wasn't an idea of the Democrats. Actually, this was originally from the conservative think tank, the Heritage Foundation, and then put into law by then Governor of Massachusetts, Republican Mitt Romney. And so this basic plan applied to the rest of the United States came from a Republican think tank and a Republican governor in albeit a very Democratic-leaning state in Massachusetts. The basic idea of the Affordable Care Act is to get everybody into the healthcare market, because people who were not covered were able to essentially free ride. They would get no medical treatment unless it was a really severe emergency, in which case hospitals would usually treat them. But because they were not insured, the hospitals would just have to eat the cost of their treatment and usually pass that on to the rest of people. So then this way we see that that system had a lot of really powerful negative externalities. It does this by providing subsidies for poor people. So it says you're going to have healthcare coverage, but it expands subsidies for the poor to try and create incentives for people even when they are in financial difficulties to get health care. It also sets up exchanges within states for people who are not covered by their employers, and it gets rid of the formerly very common practice of excluding anybody with a pre-existing condition from eligibility for having health insurance. So it used to be that, say, you'd had a heart attack and you lost your job, so you lost the insurance that came with your job. You go out to try and buy insurance for yourself, and because you've had cardiovascular issues in the past, you were considered too high risk for insurers, and that was a very politically unpopular idea with most Americans. So the idea of the Affordable Care Act was, we're going to make it illegal for you to not have insurance, but we're also going to make it illegal by using the state's sovereign power and state regulation, made it illegal for insurance companies to exclude people on the basis of having a pre-existing condition. It also regulated a number of treatments that were necessary in order for an insurance plan to be legal to fly. And it had a great emphasis on things like preventative care. The individual mandate was really the linchpin of this. It was really the central element. And what that meant was every person was mandated to, or forced to, get health insurance. This is the idea that you are forced to buy into the insurance market. You cannot free ride. You have to take part in this market. And you would, if you did not, you would be punished, and you'd be punished with higher taxes. So if you couldn't prove that you had health insurance, your tax bill would go way up. And this way, again, we see the government working to alter incentives. So if this has had the effect of, most people would argue it has not fixed the problem of skyrocketing medical costs within the United States. It has, however, expanded coverage to well over 20 million people that were not insured beforehand. And most analyses agree that healthcare healthcare costs have increased at a slower rate than they would have otherwise. And so this has been an enormously contentious issue, and indeed for several election cycles, Republicans ran on a platform of getting rid of Obamacare. And finally, we have what's going on today with the American Health Care Act. Now, this is something that just passed the House last week, so this is super breaking news, and the idea is that they are going to reform the American health care system to get it away from Obamacare, which has been very unpopular for the Republican base. The goal is to really decrease government intervention in the healthcare market. Now, as a political scientist, I kind of have to take a step out of the American political system and once again note that we have, until the Affordable Care Act or Obamacare, had much lower than average government intervention in the healthcare market. And this is trying to once again move that that back to very low government intervention in the healthcare market. It ends the individual mandate. It ends that tax fee for the uninsured, and it also deregulates a lot of aspects of the various insurance plans. And so the idea is, whereas the Affordable Care Act, the ACA, required insurance plans to provide certain services to meet certain bars for being legal, this strips away a lot of those. However, the big contentious issue with this bill has been what to do about the pre-existing conditions issue, and what their response is that people in pre-existing conditions are going to sort of be shifted to a special kind of insurance. It's called a high-risk pool, and it's unclear, at least right now to me, exactly what that means and how that'll pay out, but this is an idea that they are going to try and keep these people insured, but there will be sort of a special kind of insurance. So this is the state of the current debate. This has passed the House, but it is going to the Senate, and of course the Senate would have to pass it as well before it could go to the president's desk for his signature and become law. And it looks like it's a pretty contentious fight in the Senate, and so we'll see what happens. But in the meantime, I'm going to ask you all what you think should be the American healthcare plan. And as you do so, I'm going to ask you to think through a number of key concepts from our course and apply them to the issue of U.S. healthcare reform. Now, one of those key concepts that I'm going to introduce now, that I'm going to ask for you to think about as you formulate your response, is the idea of a social right. And I'm going to ask you whether or not you think that healthcare is a social right. So what is this? A social right is something beyond the basic political or civil rights, and it was introduced by the scholar T.H. Marshall. And so civil and political rights are rights to certain things like due process, rights to the freedom of speech, the freedom of assembly, so on and so forth. These are things that are politically guaranteed, and typically you'll also hear these called negative rights. They're things that the government can't take away from you, things that the government can't force you to do or not do. Well, social rights are a little bit more. They are a right to a certain standard of living, a standard of dignity. T.H. Marshall says, a social right is the right to share to the full in the social heritage and to live the life of a civilized being according to the standards prevailing in society. So what do we note here? Well, this is the life of a civilized being according to the standards prevailing in society. This is sort of subjective. What does it mean to live the life of a civilized being? What are the standards prevailing in society? But the basic idea here, I think is intuitively clear, and it's that if the standards prevailing in society are that most people are able to feed, clothe, and shelter themselves well, then that should be a social right that everybody in society should have access to. Social rights are simply the idea of giving everybody in society a certain standard of living. Now, you can think of very minimalistic social rights. So you could talk about healthcare, just sort of the ability to get medical treatment for a medical emergency as a minimalistic social right, or you could go all the way and say that everybody should have access to higher education and very comprehensive healthcare, et cetera, or anywhere in between. So this is just this is another concept that I think will provide very useful in us thinking about, well, what should we do? Where should we draw the line between state regulation and letting the market mechanisms work as they would unregulated with regards to healthcare? Now, as we think about that, which of our classic ideologies would you say would have the biggest support for social rights? Classic liberalism? No, probably not, because classic liberals favor smaller states to the greatest extent possible, which would put an emphasis on civil and political rights so people can be free, but not upon social rights. Conservatism actually has typically had pretty solid support for social rights, and that's the idea because classic conservatism tries to maintain traditional structures of authority, traditional family structures, et cetera. It has seen a strong role for providing for people to preserve those structures. So, for example, providing lots and lots of paid maternity leave for mothers to try and maintain the family union. Of course, socialism or communism also would have very, very high support for social rights typically, because they are saying that everybody should have a right to sort of equal access to the standards prevailing in society. So Another new concept I'm going to ask you to apply to the idea of healthcare. I'll also be asking you to apply other concepts such as perverse incentives and the veil of ignorance, and thinking about the differences between market mechanisms and state authority to this idea. So to do well on this, you really do need to watch Sick Around the World. It'll take an hour of your time. They're going to take you to 5 different democratic capitalist states that all have different types of healthcare. And as you watch it, consider these questions. So first of all, what are the different models of healthcare? I will also ask you in your essay for your midterm to think about social insurance and single-payer systems. And these are things that the documentary are going to go over in great detail. And if after watching the documentary they're not clear, then we should talk, or you should let me know on the Q&A board. As you watch, think about the different elements that these states typically regulate when it comes to the healthcare markets. You'll see that actually these 5 very different states, you're going to go to Germany, you're going to go to the United Kingdom, you're going to go to Taiwan, right? These are very, very different societies, and yet they have some similarities. They have some similar rules that they apply to the healthcare market. So which elements of the healthcare market do these states regulate, and what are the effects of this regulation? And then finally, the most important thing is, what do you think the best model would be for the United States to follow? Or do we need our own model, and what would that model look like? Okay. Well, that's lots to think about, and I'm very, very excited to read your midterm essays about how you would reform healthcare. You have a little bit of time to think about that, but I will very much look forward to that. As always, please get in touch if you have any questions, concerns, or comments at all on the Q&A boards. Have a wonderful day.